Welcome back to Voices for Vitality, where we highlight not only the individuals who are choosing to stay active, independent, and engaged, but also the incredible people and programs that help make that possible. So here's a question that many of us never think to ask until we're right in the middle of a hard moment. When your health gets complicated, a new diagnosis, maybe three specialists who don't talk to each other, a stack of paperwork, who's in your corner helping you make sense of all of it? Well, today I'm sitting down with someone whose entire job is to be exactly that person. In my world, we meet so many amazing people who are doing their best to stay healthy, but I also see how confusing and overwhelming the medical world can be. You leave an appointment with more questions than answers. You're managing a loved one's care and you don't know what you don't know. So you find yourself thinking, I wish I knew somebody who could just walk me through this. Well, that somebody exists, and many people have no idea. She's my guest today, Dr. Kaitlin DeMaagd. She is a nurse practitioner with more than 15 years of experience in home-based care, geriatrics, and hospice. She founded a business called It Is Well Consulting, where she acts as a guide and an advocate for families navigating aging and complex health decisions. Katie, I am so glad you're here because I think what you do is so incredibly valuable. I think that as a healthcare professional that is on that team, throwing education and information at individuals, I always wish that I could just say, like, here, talk to Dr. Katie. She can help you. Instead, we spend so much time trying to help our patients navigate this crazy healthcare system.
Yes, thank you so much for having me, Jenna. I'm excited to be here.
Absolutely. So before we get talking about what you do, I would love for people to know who you are. So can you tell us a little bit about yourself and how you ended up in the older adult space?
Yeah, for sure. So I grew up in the West Michigan area, been married to my husband for almost 15 years. I have a couple of kids. We live in the Grand Rapids area now. But growing up and throughout my life, I've always been very close with my grandparents and great-grandparents, and grew to have an interest in healthcare. So I felt kind of very naturally, as my studies and schooling continued, that just was kind of what I gravitated towards. And I kind of began walking alongside my grandmother was one of the first folks that I was kind of a companion for, and that was already back in high school. And kind of as my expertise shifted with my education, I kind of walked alongside family and friends in different ways, and just saw the need and recently made it more formal.
So it sounds very organic, right? Just kind of like
Mhm.
happened that way. I love that. So
Mhm.
I read the name of your company, It Is Well, has a personal story behind it. Can you tell us a little bit about where that name came from?
Yes. So It Is Well, it's a part of a hymn, and it happened to be one of my great grandmother's favorite hymns. And if you're familiar with the hymn, part of the message is kind of even in the dark times, how can we still have peace? And I thought that that was really applicable and spoke to the aging process where aging can be beautiful and peaceful, and but can also be so difficult and scary sometimes. And my faith truly roots me in having peace despite those difficult things, and gives me hope for the work that I do. So that's kind of the foundation of where I come from.
I love that because you're so right. Like nothing in life really does prepare you for the stressors that you experience as you get older because they're unlike anything you experienced in all the years leading up to that.
And sometimes even the best plans don't go as planned, and it's still hard. And so, um, yeah, you're
Yeah.
right.
So now you grew up really close to your grandparents and great grandparents, it sounds like. How
hmm
did those relationships shape the way that you view aging and caregiving?
Yeah, I would say just being so close with them and walking alongside them in their healthcare journeys. And then with my healthcare background, kind of watching things happen, or watching them get new diagnoses, or see more specialists and have more questions, and sometimes being able to answer those or help explain things to them, just in the moment, because you're there, because you're spending time with them. I think that just very organically happened as the years went on and as their needs got more complex over time.
So do you feel like there was a certain situation or experience that you experienced, whether it was with your family or any of the patients that you had been seeing as a nurse, where you thought, families really need this service and I don't see it around anywhere, so I'm just going to be that person?
Mm-hmm. I would say the examples that come to mind like most vividly are when a family is in a moment of crisis, like with a fall or a hospitalization. That can get very complex very quickly. And in kind of a couple big crises that I've been involved with in more recent years, family, the elder is scared, the family is scared. There's a lot to communicate. There's a lot to understand. And I just found myself kind of in that quarterback role of getting information organized, explaining it to people, communicating it, making sure that we were following up with the right things when we left the hospital, and following them closely as they recovered. I just saw that that was a need for someone to quarterback that crisis and hopefully get out of that crisis well.
Yeah, which I think is so incredibly helpful, because I know that before I started Vitality at Home, I was working in home health care, and
Mhm.
we would see all the individuals right upon discharge from the hospital, and they would have this stack of papers and this stack of medications and have no idea what to do. And I would say to them, well, what happened when you were in the hospital? And my patient and any of their caregivers around would be like, no idea. Well,
Mhm.
did they talk to you about this? Did they talk to you about that? No idea. Knowing full
Mhm.
well, as a healthcare provider, they definitely talk to you about all of this stuff.
Yeah.
And it's such a fight or flight situation when you're unexpectedly in the hospital that
Mhm.
these individuals just cannot process anything
Mhm.
that's going on with them. So,
Mhm.
so in the simplest terms, what is an elder care consultant and what is it exactly that you do?
I kind of mentioned it in my last answer, but I feel like the easiest way to describe it is I'm just the quarterback for your loved one's healthcare needs. And I kind of take over that role of navigating things for your loved ones so that you can get back to focusing on what matters most, which is your relationship with your loved one.
So how do you feel, or how can you explain to people who may be listening how it's different from the people that they already know? So their primary care physician's office or the social worker at the hospital, or even a lot of people now have case managers through their
Mhm.
insurance company that they believe do the same, like a similar thing as you.
Yes, that's a really good question. And I would say all those members of the healthcare team are critical for elders and as we age. And I think I just come from a unique position where as a nurse practitioner who's worked in home healthcare, geriatrics, and hospice, I've just seen a lot and understand the medical system in its complexities. And even when every team member is doing their best and trying really hard, things can still slip through the cracks. And I've seen it. And so I know how to anticipate it and be proactive. And my clients find that very helpful.
Yeah, I love that. And I think that other healthcare professionals on the team too find it really helpful, because I know from what we do, so much gets lost in translation.
Hmm.
And
Yes.
you can kind of be that translator as well, which is so helpful. So now a lot of our community are individuals who are fiercely independent, right? They've been living their lives independently for 70, some 80, and even 90 years, right? And
Mhm.
they are not interested in having anyone take over their decision making for them.
Mhm.
So is this a service that takes over and makes decisions for individuals, or is this something different?
Um, I I guess to answer that, when I enter a new situation with a family, it takes time to build trust and for their elder to trust me. I'm here to help them live the most independent and highest quality of life possible. And I believe that asking for help or allowing someone else to come in, we can help make that more possible because there might be resources or services that we can bring in that will promote your independence, versus, waiting to find help if you're in a crisis. And so when someone signs on with my services, I don't take over as their decision maker or their durable power of attorney for healthcare. But I do just have that extra, eyes and ears to listen to what's going on and make sure their needs are met.
So it's more of a collaborative approach where, you can go in and you can assess the situation and say, because maybe it's not an emergent situation that somebody calls you. Maybe it's just like, we're overwhelmed with getting older, and they can give you a call and you can say, here are 10 different services that I would recommend that you use. Go ahead, sift through these, and let's do a deeper dive into like one or two to help make your life a little bit more manageable.
Yes,
Okay.
exactly.
I love that. So now, who is it that typically gives you a call? Is it generally the client themselves, or is it an adult son or daughter or
I-
a caregiver?
Yeah, I would say a majority of the time it's like an adult son or daughter calling about a parent, that maybe they've noticed things, either physical or cognitive decline, that that their parent seems to be having a harder time managing things, and they're just looking for someone to help navigate those next steps.
Can you paint us a picture, like maybe give us an example of a story where somebody called you, and the family is like, all right, we need help. We've got to call Katie.
Yes. I would say one was a a daughter contacted me and was just like, what's going on with my parent is starting to get really complex and it's starting to affect our relationship. She's really independent, doesn't want to ask for help. Do you think you could help us? And that was a very delicate situation in kind of introducing me and developing that relationship. But we've been able to develop trust, and it's been really helpful for that family.
I love that because I feel as though it's so much softer. Recommendations are so much softer coming from somebody else than the adult child. I mean, I see so often that,
Mhm.
an adult child will call while I'm in the middle of a physical therapy session and the patient will hang up and say, she just wants to control my life. I'm like, well, she's just
Yes.
trying to help. Whereas if you're the one calling, it's like, oh, that Katie, she's just so helpful.
Yes. And that is the case, a lot of the time. And sometimes it is just helpful to have kind of a third party that can
Yeah.
speak into things. Maybe they're the same topics, but it just can be received a little bit differently by the elder if it comes from somebody else. And
Totally.
yeah, a lot of times I can just say, in my experience, I've seen this go really well and this go not very good, based on this information, what do you think we could do with your loved one?
Yeah.
So just sharing from my experience and not just going out there and barking out, we got to do this.
Right. I
So,
love that. Going in
yeah,
like cleaning house.
yeah,
It doesn't
yeah.
go over very well.
No, it does not.
So now I know so many people leave doctor's appointments, and on the drive home, they realize they forgot to ask, their burning questions. I try and coach people all the time, like, okay, you're going to see your doctor. Let's write down all these questions that you may have. And sometimes those questions are forgotten to be asked at the doctor's appointment. Do you help with that?
Yes, absolutely. I whether I attend an appointment with someone in person or virtually, going into it, I already have the questions that I want to ask. And then if, my client has other questions, we make sure we have those outlined. And, appointments, sometimes they can be complex and they can kind of go off on a tangent. And then you look down, you're like, oh, this was really important. We didn't talk about this. And it's like, either you forget to ask or you feel bad asking. And I'm just the advocate to just be like, hey, let's ask this question. Or if we forgot to ask it, I'll call the office back and speak with one of the nurses and say, oh, we forgot to ask this. Can you send a message along?
Now, are
So
you going to appointments with your clients?
yes.
Oh, so you are right next to them,
Mhm.
making them feel comfortable the whole time. Oh, that's
Yes.
incredible. Okay.
Yes.
I love that. I love
Yes. So if they'll have me, then I will go. And then after every encounter that I'm with them, I kind of write up a summary of everything that happened, and then very specific. These are our next steps. This is what I'm going to follow through on. This is when I'm going to see you next. This is when I'm going to call you next. And if that plan needs to be communicated with a family member or someone else involved in the care team, then I give them that information too, and it just kind of keeps everybody on the same page.
Oh, that's incredible.
Mhm.
So now medication management,
Mhm.
specialist, test results, insurance, all of those things can totally feel like a full-time job for people. So when someone is drowning in all of that, at what point do you, or what does it look like for you to step in and sort all that out?
Um, I think it varies depending on the situation. I think one of the most helpful things is, when I do get invited in to help, just kind of getting everything organized, kind of outlining, okay, who's involved in care, who's prescribing what, is there anything urgent upcoming, test results. So just kind of getting a lay of the land, and then kind of curating what we do next from there, because there's a lot going on and it might be really organized over here, but systems don't talk to each other, or things are in the computer, not on paper, or vice versa.
Right.
So kind of getting organized and coming up with a plan from there.
Well, and what's so great, I think, about your nursing background too, is that you can translate, like, you're taking this medication for this issue, you're taking that medication for that issue, you're taking this medication because of a side effect for that medication.
Mhm.
I feel like so many older adults are just thrown, three medications from this doctor, three medications from that doctor, and there's no cohesion to any of it. And so they can tend to get super confused. And with your
Mhm.
background, I think it's great to be able to talk to them in language that they understand, in
Mhm.
much less of a fight or flight situation, right? Like when they're at the doctor's office, it can be very intimidating, but
Yes.
if you've got them in their own home and they're sitting at their kitchen table, it's a totally different ball game.
Yes. And that's one thing that I enjoy with my clients and their families is educating them about stuff, answering their questions about medicines or treatment plans. And, sometimes they ask the same question over and over again. And I answer it each time. And it's just kind of a part of the process. But yeah, that's definitely a piece of it too, educating and collaborating. Yeah.
So great. So now let's talk about the hard transitions. So going from the hospital to rehab, or harder yet, deciding when it's time to transition from home to maybe assisted living. So those
Mhm.
moments can be so emotional for individuals. How do
Mhm.
you help families through them?
Um, that can be, those can be really hard situations. Um, as often as I can, or in the right context, I try to start having that conversation early,
Mhm.
and coming up with a plan for the future. So if you did need help, or if you did have to move at some point, whether that's something we saw coming gradually or a big event happened, who would you call and where would you want to go? Because so often if we wait until a crisis situation or a fall or a broken hip or something like that, you might not get your first choice of caregivers or placement. And so sometimes we can plan rather nicely for that. And then, but sometimes it's kind of all in, and it's like, no, we got to make some changes pretty fast here. And connecting the right people and getting the right assessments, just a process of diving in.
Yeah, I think having a plan is so important and something that we stress with our clients too. I mean, ultimately, our goal for individuals is for them to be able to age in place and have their home be their last stop on this earth. But you're so right. The reality is, like, we don't expect to have a hip fracture, and a hip fracture in your mid to late 80s can be really pretty devastating. And if you don't have a plan, you may end up somewhere that you just don't want to be. So
Mm-hmm.
I love that you encourage that having a plan too.
Mm-hmm.
I
Yeah.
think it makes all the difference in the world. And then it makes when or if that happens, it makes it not so stressful because you're like, okay, this is a bummer, but I've got a plan.
Yes, exactly. Exactly. And I think families find that very empowering to
Mhm.
have a plan, and it provides a lot of peace of mind as much as you can for
Yeah,
those maybe unexpected situations.
absolutely. Absolutely.
Mhm.
So now let's say somebody that's listening thinks, oh my gosh, this is exactly what my family needs. What actually happens first? So can you kind of walk through how someone gets started with you?
Yeah, it's pretty simple. They can reach out to me either through social media or send me an email, and we'll set up a time to chat over the phone free of charge, just to kind of tell me a little bit about what's going on and the situation and see if we're a good fit. And then we kind of go on from there.
So let's say you guys are a good fit, then you move on
Mhm.
to like your real first consultation. What
Mhm.
should people expect to walk away with from that? And oh, actually, is that in person or virtual?
Um, I try to do everything in person if
Okay.
possible. Um, I think there's a lot that you can gather from someone's home environment that you might not pick up on in a video or over the telephone. So especially as I'm just getting to know somebody, that's really helpful. The initial visit is going to be a lot of questions, a lot of show me what paperwork you have, show me your pills, kind of giving me a lay of the land of what you do have available. And early on in the process, a couple things that are of the highest priority is I want to make sure that the elder is safe. So that's important right off the bat. And then organization, I love to do that kind of in the first couple of visits. Um, if they want me to, I create a little hard copy, a little binder that has kind of the nuts and bolts in it, that they can hold and they can read and they can take it to their appointments. It's kind of feels a little old school because everything's all electronic now, but it's very helpful for folks to have that all synthesized and consolidated, and they feel like they kind of know what's going on a little bit more.
Well, and I think having that binder, while it seems a little old school, I know for me personally, I hate to like get in my phone and start fumbling like, oh, well, where did I do that? Where did I put this? Is this my email? Is this in my notes? This is my text messages? Like, I don't, it can be anywhere in the phone. And then
Mhm.
you're stressed out. You're trying not to waste anyone's time. I
Yep.
think like, a binder is great.
Yes.
I
Yes.
love the good old like pen and paper
Hmm.
method.
Yep. Yep. When I started my business, I went out and I got a new printer. And I'm like, oh, printing's the best.
Yes, exactly. Oh gosh, I always think if I could go back to just like handwriting my notes, I
Hmm.
I would be so much more efficient and people they
Yep.
would make better sense.
Probably.
So now is this something that people use once to just get organized or do they use your service ongoing? And then how do you kind of figure out which side of that each individual needs?
I'd say most of the folks that I work with, it's ongoing, and the needs can vary.
Mhm.
Some weeks, months, they don't need me very much. They're doing good. We just check in every once in a while. And then there are more intense moments where there's more going on. So most folks use me ongoing. But if there was someone that wanted to use my services just to kind of get organized and then have me come up with a list of recommendations. Like, I think you should look and do these 10 things. If you don't want to hire me to do it, this is what I recommend, and you take it from here.
Mhm.
And so that could be an option for folks. And then, in the event that something happened down the road or a year later and they're in a crisis and they want my help, the nice thing about that is I'm familiar with their loved one and can jump in and just be like, all right, tell me what's going on. And so that can be almost like a backup safety net for folks if they just want to get organized and then have me in their mind for future needs if something comes up.
Oh, that's great. That's so
Mhm.
great. So without getting too detailed, how does the cost of this work in general? I think so many people are just afraid to ask, about pricing.
Yeah.
So how does it work for you?
Right now, all of my clients just pay an hourly consultative rate. So it's pretty straightforward right now.
Okay, so anytime you're like one-on-one with them,
Yes,
it's
one-on-one with
like
them,
billable
or
hours, I guess you could say.
yes,
Okay,
yes. So
cool.
that includes time spent in person, or if I'm on the phone making calls and coordinating things, and then time documenting and communicating notes to
Yeah.
folks. hmm
Okay. That's
Yeah.
awesome. So now the word that I keep coming back to with you is advocate.
hmm
So what does it mean to you to have somebody advocate for you in a medical setting? And why is that so powerful when it comes to aging adults, especially?
hmm I think, you know, we're living longer, and we're living longer with more complex health issues. And I think I said it before, well, there's the durable power of attorney for healthcare, or the healthcare advocate, which is, a formal document that designates who your loved one would trust to make medical decisions if they couldn't make them on their own. So, I don't automatically become that, but being the kind of advocate with my client in a visit just means that I'm an extra set of eyes and ears with them to speak up if questions aren't answered. And I think that folks find that my goal is that they leave a medical appointment feeling encouraged and felt heard versus feeling really discouraged and confused.
Mhm.
And even if they left the appointment that way, but I feel like we got everything covered, I'm like, you know what? That was a little confusing. We're going to talk about it. We're going to sit down and sort through everything. And I'm going to make sure that we follow through on the things we need to. So it's okay that that was confusing for you. Or, I was like, I got the message, and I can sit with you and we'll take the time to walk through everything.
That's great. So now let's talk a little bit about the families that you work with.
Mhm,
Families can
mhm,
get stretched so thin in situations
mhm,
like this and oftentimes don't agree, right? You've got
mhm.
you got a son and a daughter that don't agree, and then you've got the daughter and the daughter that agree, and then the son and the other daughter, and it can become such a mess, right? So when everyone doesn't agree, how do you get everybody on the same page?
Um, I'd say there's no perfect solution for that. Um, I think being a third party in that situation is helpful,
Mhm.
and just approaching it, in a very respectful, gentle way. And I found kind of by sharing like stories from my experience of, these are things that I've seen go really well if we do this, and I've seen if we don't do this, like that's not going to might not go very well. So I think sharing specific examples with folks and just kind of being the liaison between maybe the disagreeing siblings is helpful, so that they're not having to maybe navigate that just themselves. Having that buffer, me being that buffer, is helpful. And so, yeah.
Yeah. And I read in some of your stuff that, you are consistently going back to this philosophy of peace is possible, even in really hard seasons. So what does peace look like for the families that you've worked with?
Um, uh, I would say two things. One would be relief that they're no longer carrying that burden alone.
Mhm.
Um, and then I would say gratitude, in finally feeling heard by the healthcare system and feeling like they're not alone.
I love that.
So, mhm.
I absolutely love that. So now we know as healthcare professionals that not everyone listening is going to pick up the phone today. So, what is one simple thing every aging adult or their family can do this week to be more prepared for what may come in the future?
Mhm. I'd say if I could only recommend one thing in preparing for the future, I'd say get organized.
Yeah.
Start getting organized. I kind of have a basic list of 10 things that, I share with folks. And it's like, even if you don't know all the answers to all these things, just pick away at what you do know. Because even if you know a few of the medicines and what doctors they go to, even those little things can be helpful, and empower you to just be more knowledgeable in those situations.
Yeah, one small step makes a huge difference.
Yes.
Totally. So what are 2 or 3 questions that you feel that people should be asking their doctors, but usually don't?
I'd say number one is kind of asking the question if the doctor is, you know, recommending a new treatment plan or a medication, asking the question, how is this going to affect the quantity of my life or the quality of my life?
I love that. Oh, that is
Yes.
so good. Oh, that's
Yeah.
so good.
Because I think there's a little gray area as we get older, and
Yeah.
what are you focused on, and what matters most? And so that's a question I would ask. And then secondly would be asking whatever healthcare provider you're seeing, if you do see other doctors or specialists, kind of asking that doctor in the moment, okay, well, are you going to communicate this plan with my other doctor? Or, do I need to relay this message to my other doctor? Because maybe they're in a different electronic health record and they don't talk to each other, or it's like, do I have to sign a release form to get you to send it over? So how are you going to communicate with the rest of my healthcare team? Asking that question, if you don't have me to do it or ask, that would be a recommendation.
I love that. So great. Such great questions. Now, if you could get any older adult to stop believing one myth about aging or the healthcare system, what would it be?
I don't know if it's a myth or maybe more like a mantra, but
Yeah.
it would be, it's always too soon before it's too late.
Oh, love that
So
one.
yeah,
Yeah, that's
so
great.
yeah, don't
That's
put
great.
things off. Always,
Yeah.
start planning. Yeah.
Be prepared. Be prepared.
Yes. Yeah.
Hope for the best, plan for the worst, right?
Yeah. Yeah. Yeah.
Now, what is the most common thing that you hear from families after they've worked with you? So one thing that they maybe wish they had known sooner.
I'd say most of the responses that I get are that they wish they had met or started working with me sooner.
Yeah. Yeah.
Mhm.
Yeah.
Yeah.
We hear that a lot as well.
Yes. I bet you
Um,
do.
yeah, right.
Yeah.
Which is a perfect segue into my next question for you. Because we hear from people so often like, I'm doing fine. I don't need therapy. I haven't fallen yet. Like this is all
Mhm.
so normal. This is for people
Mhm.
who are really struggling.
Mhm.
So what is the value in reaching out before things get hard?
Um, I think that planning before a crisis can be invaluable, especially when it comes to promoting independence for your loved one. It can be really difficult to navigate a crisis type situation. And so I think that asking for help or asking for someone to walk alongside you sooner versus later can really preserve your independence,
Yeah.
and really, protect their dignity as well.
Absolutely. Absolutely. And so then for those who may feel like completely overwhelmed and incredibly disorganized right now, um,
Mhm.
do you feel like it's ever too late to start getting organized and start getting their lives together?
No, I think it's never too late. So even if you can just organize or do a couple of things, each little bit that you do is going to empower you. So it's never too late. But I hear you. It can be very overwhelming, and it can get overwhelming to the point where you just give up.
Yeah.
And so it is hard. But encouraging folks to not give up and just start with what you are able to do and just take it one step at a time.
Yeah, for
Mhm.
sure. So now when you imagine a family or an individual that you've worked with a year after you've worked with them, what is one thing you hope for them is different?
I hope that they're enjoying their relationship with each other. I hope that they feel like their loved one has the the highest quality of life possible, and that they know they have a partner and someone walking alongside them for whatever comes next.
Oh, that's great. And other than
Mhm.
that, is there any other one thing that you want every person listening to remember from our conversation?
Oh, um, I would say that aging process can be lonely and hard. And I'm here to say that you don't have to navigate it alone. And you're not alone out there. So,
Oh, I love that.
yeah.
Katie, thank you so very much. And I hope that everyone listening feels real comfort in knowing that someone like you exists. So here's what I want you all to take away. If you've ever felt lost in the medical maze or like or feel like you're watching a parent or spouse go through something and you don't know where to turn, you do not have to figure it out alone. That is the whole reason Dr. Katie does what she does. The best first step costs you absolutely nothing. Katie offers a 15-minute call just to talk to see if you're a good fit. So, Katie, where is the best place for people to reach you?
That would be my email address, which is drkatie@itiswellconsulting.com.
Okay, awesome. And I can put that in the description down below. So
Awesome.
thank you all for spending this time with us. Take good care of yourselves. And remember, staying independent and living supported are not opposites. They go hand in hand. So until next time, keep living your best life.